Hello, family. Hello, my fellow ambassadors. Greetings to you, passerbys, as well as our regular visitors. I welcome you to the arena of ambassador for a fulfilling lifestyle. My name is yours naturally, and I am naturally yours. I welcome you today in our conversation when we are discussing health checks in preparation for the year 2026. You know, I stay in South Africa, and there's this what's called an 8-point check that you do on a car before you hit the road. Things that are commonly checked with the 8-point. I'm just gonna read them. You know, it's 8 things that you check. 1 is the tires and the wheels. 2 is the lights and the electrics. You check the fluids, you check the brakes. 5, you check the wipers and the washers. 6, you check the battery. 7, the belts and the hoses. And 8, you check the exterior and the interior of the car. I'm not sure if it's in that particular order, but those are the things you actually check. It's categorized into 8 points, and that's what makes it an 8-point check. Now that we are raring and revving, you know, to get going and fly and ride this wave that's called 2026, it's also very important for us to make sure we do our 8-point check on our body, on our health. You know, I believe that we are a spirit in a physical world and inside a body and having a physical experience. And how can your spirit move forward when the vessel that carries it's not up to scratch? So it's a practice that me and my family, we are and have been doing for years now. And I find it very valuable, and I think you would benefit from it. My philosophy and my thinking is this: it doesn't have to be broken. You don't have to be sick for you to have it checked. You know, it's like maintenance. Like when you are cleaning your house, you know, you don't have to wait for it to be filthy, dirty. You don't have to wait for the pipes in your house or electricals in your house to be all messed up before you have them checked. It's important that we service, you know, even your car, you service it. So that's what we're doing now in today's conversation. We're just checking in with one another like, hey, my fellow ambassador, so the year has started. You know, what is it that I can check to make sure that this vessel, that is my body, is ready for the year ahead? So, of course, whatever we'll be sharing, it does not encompass everything, but I think it gives a very good high level of the things that you need to make sure that you have a look into. The best time to do this, I believe, it's between January and February, most preferably January. But we all know how January is like, because most people are like broke because it's been December, it's been New Year, a lot of money has been spent, and not everyone is on medical aid. So maybe then, hence, like the first 3 months of the year, but most preferably, as much as possible, get it over and done in January. Some of the appointments you would have set up the year before, but January, February are the best months. If you have to push it, make sure that by March you are done, because you don't want it to be something that is lingering. So we are going to call this an 8-point health body check for your 2026. So I've listed them in 8. I'm also going to share them on the description box so that you can at least have a look at them and note them down for you. If this is new to you, I just want to say, just give it a try and see how it goes. It's very nice because you're just going to the doctors, you're going to the health professionals and say, hey, look, 2026 is raring and revving and I don't want to miss this ride. Please check me up if it's all good with me. And today I did go for, actually last week I went for my first checkup, and today I went with my son. So we've had our first tick box ticked. Tomorrow we're going to a second one with our psychologist for a mental and emotional well-being check. Let's just go through the list together and just saying these are the tips I'd like to share with you. It has worked for me for my physical body. There's other checks, of course, in your finances and wada, but here today we are focusing on health and your body. So let's start. 1. your GP or clinic visit for your annual checkup. So just make sure that at the start of the year, as we are starting, visit your GP, visit your local clinic, just to have an annual checkup. The medical staff, they know what it is. You don't need to know the nitty-gritties of it, but just say, I'm here for my annual checkup. I'm hearing that there's this thing called annual checkup. I'm here for it. Normally, they will check your BP, they will check your sugar, your cholesterol, they will do quite a few other checks. They will check your weight. They will check maybe your height. They'll be asking you questions about your health. And this is a great opportunity to ask questions if there is anything about your body or your mind, your emotional state that you are not sure about, or things that you were not understanding. So this is a great visit, especially for those who don't frequent doctors, because you get an opportunity to sit with a health professional and then you ask them, maybe you've always had an ache on your side. You can say, you know what, I've been having this ache on my side when this and that happened. So it's just an overall general health talk or chat that you would like to have with them. And then 2, the second check that is very important for your body at the start of your year, it's the important and necessary blood works. So we're not all gonna do the same blood works, but it's very important that most the doctors and the medical staff would know. I'm not a medical practitioner, so I wouldn't know what are critical for you or not for you, but most definitely we did say that there in the doctor's rooms or clinic you would have done your blood pressure. So when you do your important blood works, if I'm to look at mine, let me pull mine. The blood works that I did was to check my full blood count. And then on the biochemistry, we did the renal checks where they were checking, I think it's my kidneys, the lipid profile, that would be your cholesterol. And then they also checked on the still biochemistry. Is this one biochemistry? Yes, still on biochemistry, we had my glucose metabolism checked. As well, on endocrinology, we had my thyroid checked. So those are very important to have checked. I wouldn't know. I think it is for everybody very important for everybody to have those things checked. Over and above that, I would say for people who are sexually active, it's a great opportunity, not just to check your HIV and AIDS, because we know people are doing those checks, but there's blood tests that you can do to check check for any STIs. Like I said, this one is important for people who are sexually active, whether you are sexually active with different partners, or you've broken up with your partner or with the same partner. Remember, you are responsible for your own body. You wouldn't know what the other person is. You may be exclusive with them, but you don't know what they are doing, right? And it's not necessarily what they are doing. Sometimes people get exposed to situations that they did not mean to, and they keep it secret. So what I would say for those who are sexually active, make sure, irrespective, it's not about the number of partners you have or partners you've been active with, looking back, but make sure that not just your HIV and AIDS test, make sure that you check for STIs, you check for HPV, you check for HSV, gonorrhea, syphilis. It's quite a list, but the medical professionals, they know exactly. Just say you just want to check your, the STI blood checks and wada. It's important that you do these checks because some things you may not be aware of. Some sicknesses, some diseases, they lie in your body dormant and they hide, and you do not know that you have them. And then you find that you are infecting other people unaware. Perfect example of this, you find like the disease like herpes. You may have a herpes virus in your body and you are not aware because you are not reacting to it. Your body is not reacting to it, but it's lying dormant in your body. And then you find that you pass on certain diseases to other people who are unsuspecting, unaware, and you don't do it intentionally. And unfortunately for them, you find that their bodies, they react differently. So that's some of the blood checks that you would like to have done as well. And based on your medical history and things like that, your medical professional will be able to guide you through on what else you want to check. And if you've got things that you're concerned about, I think this is a great opportunity to have that checked. And still on the, which is still, we are still on 2, and still on that part, what I'd like to advise you when you get your blood checks, when you go back for the results, don't take the call. They will take the call, your results are in, everything is good. Like, okay, it's good. Book an appointment with your doctor or whoever was taking your blood. Book an appointment when you walk out of that first appointment and say, I'm booking an appointment to come back for my results. Even if everything is good, is perfect, there is no issue. Sit down with your medical professional. Let them take you through everything. And if possible, not if possible, doctors don't have a problem with that, ask for a copy of your blood, of your pathological results. Ask for your own copy so that when you go home, you can read. And while you are in the rooms, when you go back for your results, your doctor, your medical professional, they will take you through the list. Ask questions. Don't be afraid to ask questions. If there is something they say is wrong, it's a concern, ask questions about it. For example, I'll use me as an example again. As you know, as you can see, I'm a woman of an African descent, and when we look at the blood count, my leukocyte and neutrophils were on the low side. I didn't get a chance to ask my doctor about this. Both of them are a bit on the low side. But then my doctor said he went everything and said, no, everything is fine. But I was concerned when I went to research this. They said it's common for people of African descent or Arabic descent to have the leukocyte and neutrophils count, both of them down. So that cleared the concern for me. And for me, this is very important because next time I do these tests and I'm seeing that one of them has gone up or has gone too further down or there's changes, I'm able to track. And what's important is that you get a file and you file these things, and so that you are able to track, you can see what's happening inside your body. So that is 2. The third test, the third check, remember this is an 8-point check, our 8-point health and body check. So point number 3, the dentist. Please do visit your dentist. Please don't judge my 2 missing teeth. We are fixing them. We are fixing them. I don't want to lose my bone density here. So we are fixing them. Give me 2 years. So, visit your dentist. It's not about you. Dentist is going to remove your teeth. Whether you take care of your teeth or not, just go visit the dentist and say, no, look, I'm just here for an annual checkup. What I love about the medical professionals, they understand the term, I'm here for a checkup. Others, they say, is there something wrong? Is there something pain? Like, nope, nothing is paining. I'm just here to check if everything is still good. That's all. You don't have to know. You don't have to direct them. Like, check this, check that. No, just say, I'm just here to check if everything is good. You'll be surprised to learn that you may be having a cavity, you may be having an issue that is actually starting up. And what's great about that, you're able to nip issues in the bud right as they are starting. And what's great is that you've got the whole year of 2026 ahead of you. If ever there's an issue picked up, you are able to address it. And then before the problem gets big, and you go through your year knowing exactly what's happening with you. The fourth one, as you can see, I wear glasses. As you can see, I wear glasses. So due to my vision, I've come to a practice that every year I go visit an optometrist. And due to the type of the vision that I have, I also visit an ophthalmologist, the eye specialist as well, because my eye condition is rather complex. We're not going to talk about that in this video. I don't know if we'll ever talk about it or not, but visit your optometrist. You don't have to say, I don't have an eye problem, I can see anything and everything clearly. You don't know. Even if you've got a child, your small child, go take them to the optometrist. I'll use me as an example. With my vision, had my vision be picked up before I turned 9 years, that there was an issue, my vision could have been, I would have had an opportunity, or there was a possibility for my vision to have been fixed and corrected, and you find that I wouldn't be wearing glasses. But because the issue was picked up after the age of 9, nothing could be done. So all these health checks, you do them for not just for adults, even for your children. Talk to your nieces, your brothers, your sisters, your colleagues. Share with them. We're sharing the love. As iron sharpens iron. We are the change that we want to see. It starts with me, and I share with others. So have your optom visit, whether you can see properly or whatever. If ever you say, look, but I was at my optometrist in December or whatever, set it maybe in your calendar and say maybe every 12 months, I just want to go for a checkup. If you stay here in South Africa, you'll notice that your medical aid, if you are under medical aid, when you get your glasses, they say you keep it for 2 years and things like that. I would say to you, my personal advice, based on my personal experience, don't go with that. You are the one who is having the eyes, not your medical aid. If it means you have to pay out of pocket, just go have your eyes checked. You don't have to wait the 2-year period, because you don't want to pop money to pay somebody who is a professional, who's a specialist, to look into your eyes and say, your eyes are good, your eyes are this. It's like I said, certain things can be picked up early and they can be resolved or sorted. The worst that can happen, the medical professional would say, everything is good, you got nothing to worry about. And if that's the case, you got a reason to celebrate. 5, psychologist. The psychologist one for me is very, very important. And I know that us women, we don't have a problem about this, where you go to a counselor, you go to a psychologist. I do understand that some social workers, they provide counseling as well. So basically, this is not necessarily visiting a psychologist, but basically visiting a counselor, a professional who is a counselor, where you can go to and then you just go for a check. I remember last year when I went for the first time with my son, when I took my son for the first time, I was like, the psychologist was like, so what's the problem? Are you guys having a problem with your relationship? Like, no, there's no problem. In fact, everything is good, but we're just here just for a checkup, if you as a professional, and what I would like to say that is very important, especially in this day and age. There is so much pressure that we are living under. There is pressure from the community, pressure from family, pressure from school, pressure from work, the pressure that we are living under today. I don't believe that it's the same amount of pressure that a single person used to experience to live under about 10, 20, 30, 40 years ago. Our children, they are under more pressure than we were at their age. So it's very important that at a very young age, we teach our children that to keep a check on their emotional and mental well-being. We all know that cases of mental wellness have gone up. Cases of emotional wellness has gone up, especially amongst our men. So I would encourage everyone, if you are a man listening to this, do not be afraid. It does not shame you. It doesn't take anything away from you. It doesn't make you any less of a man for you as a man to go to a counselor and say, you know what, I'm struggling with a certain area of my life. Please, I just want to say that to a point where we do things and say our men's mental health also matters. So I just want to say to the women, to the sisters, we love going to the doctors, to the medical professionals. I know there are women out there who think that when you go out to a medical professional, as a woman as well, they think that you are weak. You are not weak. You are taking care of yourself. When you're not sure about your car, or even if your car is sure, but it is fine, after a certain mileage, you go to have it serviced, right? And it's not a sign of you being weak, you being anything. The same thing applies here. Take care of your mental health. Take care of your emotional health. The psychologists, the counselors, whatever you call them in your space, whether you get that counseling from an elder in your church, but just make sure you go for your annual checkup. I did it with my son. We are doing it tomorrow. Actually, that's our appointment, where you just go, you sit. If it means that they say, no, I need you to come back again, just go again. When you get there, maybe they can say, what's wrong? Me, I just walk up and say, nothing is wrong. Everything is good. But I'm here for you to check me. If there's no hidden skeletons in my closet, I'm here to just check, it's just a checkup, maintenance. I'm servicing myself just to check mentally, emotionally, is everything still kosher? Because in this day, as a people, we are so complex as human beings. We may be having issues unaware. Okay, so there is nothing wrong with that. I know I'm stressing this point only because there's been a surge in cases of mental wellness, in cases of suicide. We know that, a person, you are sitting with them today, we all happy, we all good. The next thing, a person gone. And we're all asking ourselves what happened, and they've taken their own life. So it's important that we sensitize ourselves. I think it's something we need to communicate over and over. We throw it out there, we must always put it out there. Take care of your mental and emotional health. And if ever the professionals, they pick something up, it's nothing to be ashamed of. If they pick something up, take care of it. Look after it. Take care of your health. You are more precious than any idea or stigma that you may be having. I would rather have a friend, a man, a family member who goes to a psychologist or who is on medication for whatever they need to be at, or who has to go for counseling for whatever reason, them taking care of themselves, than to have a loved one who we love today and tomorrow I wake up, they've taken away their own life. Cool. So mental and emotional check. That is one check, and it's on point number 5. Point number 6. I've split it into 2. It's actually into 3, but let's focus on the 2. I said it's a gynae or a urologist visit. So if you're a man, I don't know what the urologist does, but just go check them pipes. Is everything still good? And as a woman, go to your gynae, have yourself checked out. Like I said again, doctors, they know. Medical staff, they know. When you rock up there, they say, what's wrong? What do you need help with? You just say, no, nothing is wrong. I'm just here for a checkup. Okay. And you find that they will take maybe scans and things like that. And you'll be surprised what they find. And we pray to God, of course, there is nothing that they will find. But and as a woman, of course, they will also be doing a pap smear, which is very important. I know if you are staying in South Africa, I think the pap smear, if you are under medical aid, they say every 2 years. I just want to remind you that women are not the same. Again, the same talk we had on the optom, I'll apply it here. I'm not sure about men. Please, you will bear with me. But if the same talk or similar conversation or similar points they apply to men, please take them for yourself. But if you are a woman, you have previously been tested with certain issues. Maybe you've been tested with cells that are what's the term? Abnormal cells, and you had a procedure done. Just know that as a woman, if that is you, you will have to every year try get yourself do a pap smear, because abnormal cells, they can show up anytime and anytime. But if ever you find you had abnormal cells before, you had it sorted, it's been 20 years, still nothing, do not fret if you go every year for your pap smear and you find that there is nothing wrong. I think prevention is better than cure. You just need to look at it that way. So have your annual checkups with your gynae. Don't allow issues of I have to pay from my pocket to stop you or block you from taking care of yourself. Your medical aid, if you are in South Africa, if you do have medical aid, I think they pay every 2 years. But I advise you that if you are or you do have a concern, rather have yourself checked a bit more frequently. I don't know, I'm not a medical doctor. Anyone who's got knows medical stuff more, please, you will share there. And I would also say the annual checkup, especially the pap smear, more specifically to pap smear, I would say that for women who are sexually active, I think, I could be very wrong and I stand to be corrected. I think and I believe that women who are sexually active, you have to do your pap smear here every day. But I mean, not every day, excuse me, every year. But then, of course, when you do visit your gynae, when you do visit your urologist, you can have those conversations with them. They will advise you better. Me, I didn't study medicine. I'm not a medicine person. I'm just sharing with you the things that I do to 8-point health check my body in preparation for the year ahead. And of course, we did say urologists, gentlemen, please do take care of them pipes, take care of them family jewels. You know, you better take care. There is no shame in taking care of yourself. And like, again, nothing needs to be broken for you to have it looked at. Also, again, under point number 6, remember I said actually 3, the third point under 6, the third check, we mentioned the gynae, the urologist. The third one is any other specialist based on your health requirements as you know them. So if you know that you are a person who needs to see, and I don't know, you would know. Just go have a look and check them out. I wouldn't know. I can't even make examples. I don't want to make examples in case I get sued tomorrow. Okay, so I'm just sharing knowledge here and ideas. So any other specialist, you know, I'll make a lousy example, whether that specialist is an oncologist or cardiologist or whatever, you know, you would know who you need to see. You know your special health requirements that are specific to you, that only a specialist deals with, or you have a concern, then please make sure start of the year is the best time for you to actually start looking at these things. Number 7, deworm yourself. So number 7, you are your own doctor. So number 7, you are your own doctor. For number 7, I would say 1, deworm yourself. If you're a person who believes in, I think it's called anima or whatever. In my language, we say uzopeita, ukupeita. You know, in anima, it's like a syringe there on the exit. If you are not scared of that, okay, let me not say if you're not scared of that, but if you believe in that, not even if you believe in that, if you can, just get that done. You know, once a year, you know, just purge your system, deworm. Do whatever you can to purge your system, okay? It's important that your system is purged. It's important that your digestive system is purged, because bulk of the diseases are actually housed, if a bad word to use, but bulk of diseases in a person's body, by purging your digestive system, you are able to clear out a whole lot of issues, even things that are not related to your digestive system. You will be surprised. So I would say 7, deworm and find a way to purge your system. It's important that to purge yourself. These things are coming back, people. Yes, it's information overload. What is it? TMI, too much information. It may sound like TMI, but it may save you one day. It may save somebody else one day. So point number 7, you said deworm yourself. Please don't tell me that I can't deworm, I'm scared of worms. You go to a chemist and you say to a pharmacist, I want to deworm. And apparently it's advisable to deworm twice a year. We've been deworming here at home for more than 10 years. We always did it once a year, but we learned, I think 2-3 years back, that it's actually best done twice a year. So I wouldn't know. I'm not going to say do it twice a year. I'm not going to say do it once a year. But what I'm sharing with you is that this is a very good 8-point health check on your body as you are starting your year. Get yourself dewormed. Find a way to purge your digestive system. Other people, their systems are very sensitive. By eating roughage, green apples, already their systems, they start cleaning themselves up automatically. Number 8, last but not least, you are fully in control as well. So your 8th point, your 8th point health check on your body, it's actually taking care of the external. If you can look at everything that we have done, it's actually kind of like invasive in a way. You know, an optometrist will be putting stuff, you have to look. A dentist will say, open your mouth, they'll be doing things. So this one is more external. It's more on your hygiene. And what I would say is that every start of the year. It's a great opportunity. It's a great reminder. You don't have to set reminders everywhere, but it's time to change and get new things. Now I'm talking about your toothbrush. In as much as there's a huge different, not huge, but there's different views on this. Others change your toothbrush once a year, others twice a year. My dentist, the one I have, says like every 3 months, get a new toothbrush. I don't know if you, because our pockets are not the same. Somebody else, maybe you get a toothbrush and then find a way to sanitize your toothbrush. I don't know how, I'm not going to say how you should do it, because I'm not a specialist in this. I don't want to misinform you. But if you say, I don't have money to be changing my toothbrush every 3 months or every 6 months, what I would say is that maybe for the remainder of the year, find a way, maybe once a month. Just speaking as a local person here, just try and maybe sanitize your toothbrush. But then now at the start of the year, it's a great time to actually take care of the hygiene. These are the things that you use personally on your body, intimately on your body. So that would be your toothbrush, get it changed, your washcloths, your face wash and your body washcloth, get them changed. Somebody would say, but my washcloth is still fine, it's not old. I do understand, things can be expensive. If you can, get new ones. And if you can, the existing ones, you can actually use them as swabs or cloths around the house, a scrub lap. I don't know what you call it in your country. A scrub lap, it's actually a cloth. You use it to clean, it's just to clean, like mop the floor with the cloth, things like that. So you can use it for that. And then, if you say, I'm sorted, I don't need any of those things, I think there's ways to sanitize, especially if your products are still good. The same way you can hand over old clothes to the needy and stuff. I could be wrong. Please, I stand to be corrected. I'm not saying this to offend anyone. I think your washcloths, if they are still good and fresh, what you can do then, maybe sanitize them, wash them, deodorize them, do whatever that needs to be done that is in a condition that as you hand over your old clothes, you can hand them over to the needy as well. And then your makeup brushes, ladies. Yes, your makeup brush. You don't use your makeup brush until it's all hard and just change your makeup brushes once a year. I'm not a makeup artist. As you can see, I'm not really big on makeup. We love makeup. We love how it makes us look. But I think a dermatologist and people who work with makeup in the makeup industry, they will be the best people to tell you how often you should change your makeup brushes. But what I know is that you can't use the same makeup brush for long. At some point, you need to change it because it harbors germs, and those things, they can damage your skin and your mascara as well. Ladies, I am sorry. Just because a mascara can last you 5 years doesn't mean you keep it for 5 years. You must, at some point, you need to get rid of that mascara and get a new one. If ever there's a way to, I don't know, do something about that brush, please do let us know, because then you can do something about that brush and then you still keep we all know mascaras are very expensive. And then another last point on still number 8, on changing and getting new things, your undergarments. Your undergarments can be anything. It can be the vest, it can be your underwear, but your undergarments, this is a perfect time for you to go through your wardrobe. All your undergarments, including socks as well. Look for those that they've got holes. Look the ones that are worn out. I'm not going to say ones that are old, because something can be old and it's still new in its condition because you don't use it a lot. But stuff that is worn out, this is a great time for you to take out those things. And because, again, we don't come from the same background, same financial background, we don't have the same financial standing. Some of you will see maybe those that you can sew those things. And then if ever you feel you need new ones and those others you need to give away, then maybe you can do that. Hello. I just have to squeeze myself in, you'll excuse me. So one thing I forgot to add is that you need to go through your medicine cabinet. So what you're looking out for is the expiry date. So with regards to the expiry date, it's important that you do not keep expired medication in your house. I don't know how expired medicines can affect you. This can be medicine that you are applying on your skin, things that are like drops, you sprays into your ears, your mouth, wherever. But anything that has expired, you really want to have a look at. And ladies, your personal hygiene items like tampons, sanitary towels. I don't know what else may be there. You definitely want to look at the expiry dates, as well as certain creams and certain makeup. If there is an expiry date, you may want to look at that as well. And anything that has expired, you really do want to discard it. Anything you keep that has expired, you keep it at your own risk. Excuse me. Another one, speaking of expiry dates, another thing that you'd want to look at is going into your kitchen or into your pantry and your fridge, wherever you store food, and look again at the expiry date. Any food that's expired, you definitely do not want to keep that food. It's bad in many ways. I'll just name a few. One, it's eating up space in your house. You think you have something when you do not have anything. And another one is that it could be poisonous, especially canned food. We all know very well that canned food that has gone past the expiry date, long time past the expiry date, it can be very, very poisonous to you. So that's what I wanted to squeeze in quickly. And any things that are for personal hygiene, ladies, I'm talking to you on this one. I would say guys, but I don't know much about guys. But guys, any personal care items that have expiry date, anything you know that expires, that is for your own personal care. I'm talking to both the ladies and the guys. In the ladies side, I'm gonna drill in a bit, like things like tampons, things like sanitary towels. Please look at the expiry date. If ever any of your personal care items, it can be anything, guys, including wet wipes, you know, if there is an expiry date, including face washes and stuff, you want to go through all your personal care items, expiry dates. That's what you're looking for. Anything that has gone past the expiry date, you definitely want to get rid of. So what we're talking about here, it's three things. We mentioned items of personal care, personal hygiene items. We mentioned medication, and we also mentioned food. That's what you want to have a look at. Yes, thank you. Let's continue with the rest of the video. Okay, so this is us doing our 8-point health and body check in preparation for this wave that we are riding called 2026. Just to sum everything up, the 8-point check you need to do and get done. I would say 1, visit your GP or your local clinic for your checkup. Number 2 is to do the important and necessary blood works. Number 3, visit your dentist for your annual checkup. 4, visit your optom for your annual checkup as well. 5, visit any counselor, whether it's a psychologist, whether it's a social worker, any counselor, either from a church elder or at school. Just visit them just for your emotional and mental well-being check. And then if you are a man, visit a urologist. That is 6. If you are a woman, it will be a gynae. In addition to that, make sure you visit any specialist based on your personal health requirements as you know them or as you have concerns about them. 7, we said you must deworm and find ways to purge your digestive system. And then number 8, we said you need to go through, we're looking now on the things, personal items that you are used, taking care of your personal hygiene. And then there we say you need to change and get new things. We talked about toothbrushes, we talked about mascara, your makeup brushes, your makeup sponges. We talked about worn out undergarments, and we also talked about wash cloths. That would be your face cloth and the one that you use to wash your personal body. This would also include your loofahs, your scrubs, you know, those, whatever you are using for your own personal body. Where you can, because we don't have the same amount of money, we don't come from the same background, all of us, where you can sanitize things and make them new, freshen them up again. First check if it is doable, then you can do that. You don't have to throw away things that are still good things and get yourself into debt and get yourself all raggedy because now you are throwing away. Because the arena of ambassadors for a fulfilling lifestyle, they say throw away that old washcloth because now it's the start of the year. Okay, let's be responsible for our own health. Guys, I just want to tell you that your body is yours. Body does not, but basically what I'm trying to say, your body is your body. At the end of the day, you are responsible, you are accountable for your own body. you own your body. Take full ownership, take full responsibility for your body. Make sure that it's part of your lifestyle. Let it become part of your lifestyle. Visit your medical team, visit them, even if you have to make those individual appointments, do it. Some of the things as we've gone through, you saw that you've got full control and full ownership. Changing your personal items, you don't need a doctor, you don't need a professional, you do it yourself. Getting to deworm yourself, you don't need a doctor to tell you whatever, unless you know you've got internal issues. Then discuss it with your GP, discuss it with your medical team. If you want to deworm, can you deworm? So that's basically about it. As we are raring and revving for the year 2026, let's make sure we get that 8-point check done on our bodies, so that the spirit that is the real essence of who we are, that's really who we are, as it is housed in this vessel that we call our body. It is housed in a healthy and strong and well looked after vessel. I love you all. It's been quite a session. I hope you have benefited from this. If you say, look, I do all of these things, I'm going to say to you, please share with someone who you think may benefit from it. But again, I will share these points in the description box so that you can quickly go check them out. It won't hurt you at all. And if you say, January, I'm broke, you still have the first quarter of this year. You have Feb. You can say, oh no, I've already budgeted my January income. You still have, let's just say, the first quarter of any year, not just 2026. It's a routine, it's a practice you want to adopt. Take care of your physical body, and remember, you are a spirit being inside a physical body having a physical experience. I love you.